most of the time we're going, as I told you, there is going to be a history of kind of injury or increased workout. But before we go in detail of this question, Shabab, I just want to discuss with you the different kinds of ligaments that are in the knee and how we test them. So suppose we have the knee here. We have 3 or more, we will add 1 more as important ligaments, but let us first concentrate on 3. The first one is the cruciate ligaments, or we should just something like that. Just this is for demonstration. We have the cruciate ligaments. The cruciate ligaments help the knee from displacement anterior and posterior, okay? And the best tests on examination for these are the anterior and posterior drawer test. As we are going to see examples, and these are the drawer tests that test the cruciate ligaments. The second kind of ligaments we have are the collateral ligaments. And the collateral ligaments, we are going to face them and just demonstrate them as they are holding the knee this way from being displaced lateral and medial. And these kinds of ligaments are the medial and lateral collateral ligament. The tests for these are the varus and valgus stress test. And in this test, we are going to hold the knee and just displace the knee when it is extended. The knee stay extended, and then we just try to open the joint by applying a stress medially and laterally, okay? This is the varus and valgus stress test. And the third kind of ligaments, which is going to be in this question that we just saw, are there are kind of tissues that are extended horizontally, and these are the menisci. Okay, and the menisci are tested by 2 kinds of tests. There is the McMurray test, and the Thethely test. And we are going to just this ligament is tested, and when there is rotation, kind of rotation and flexion and extension of the knee. So it is the most complex one in kinds of the examination, and also it is the complex one to get injured. But in any of these kind that we are going to see specific questions about each one of them, when there is an injury, suspected injury, of course the first is the history, which usually is the first one. Then we are going to go for the exam and the special test. The history usually is not specific, maybe specific, maybe not, but it will not give important things about the diagnosis. What will give important things about the diagnosis is the exam and the special test. And that anyway, the third step when we are talking about investigation, the X-ray will be usually normal because this is a soft tissue. And the best next step will be if the examination is positive, will be MRI, which is the best test to detect any soft tissue injury. We are going to see different kinds of MRIs of different injuries for the ligaments. I mentioned we are going to talk about a fourth, ligaments, but this is maybe we are going to see it in the examination, but that is the ligaments that are attached to the patella. So we have the quadriceps ligaments coming from the quadriceps muscles upward, and we have the patellar tendon, which is inserted into the tibial tuberosity. Of course, you know the knee is not only one bone. We have the tibia and the fibula. But here we have the tibial tuberosity in which the patellar tendon is also inserted. So, okay. So this is just a summary about all the ligaments. So we here usually concentrate and focus on the examination. When they tell you there is something about internal and external rotation, okay, internal and external rotation, in addition to flexion and extension, think about the menisci. Okay, it is not asking here specifically about the meniscus, but this is most probably a meniscal injury or a meniscal tear, complete or partial, as we are going to see. It is tested by the McMurray test, which is illustrated here, and also we have here a video that showed you the other tests, which we are going to see in the other question. But just look how this slit test is performed.